Hey everyone, welcome back. Today we're going to be taking a deep dive, into the world of tattoo removal.
Yeah.
And you sent this in, so clearly this is something that you're
Absolutely.
thinking about maybe doing, or at least curious about. And we found this great article from the Cleveland Clinic about tattoo removal.
Really lays it all out there.
All the hows and whys and what ifs. So let's
I think it's a fascinating topic.
let's dive right in.
Yeah.
Okay, so first of all, why removal, right? We think of tattoos as being permanent.
Well, you think so, right?
Yeah,
I mean,
but people change their minds, their jobs change.
it's interesting how we often view tattoos as this permanent thing, but life rarely stands still.
Right.
And the article highlights how common it is for people to seek tattoo removal.
Yeah.
And the reasons are super relatable.
And it's not even always about regret, right?
Right. Sometimes it's just life throws curveballs,
Totally.
I mean, imagine landing that dream job.
Oh, yeah.
And then you realize,
Tattoo.
this tattoo is not going to fly with their dress code.
Yeah.
Or maybe you have a tattoo that's tied to a past relationship, and it just becomes this painful reminder every time you look at it.
Oh, yeah. So, I mean, definitely lots of reasons. And
the emotional weight of a tattoo can shift over time, too.
Oh, definitely, yeah.
What once felt meaningful might now carry baggage you'd rather not carry around, literally.
Yeah, for sure.
The article actually dives into all these different removal methods.
Oh, really?
It's surprisingly diverse.
I mean, I know laser is the most.
Of course, laser is the most popular.
But I didn't realize there were other ones.
Yeah, there's dermabrasion, chemical peels, and even surgical excision.
Wow. Okay, so when would someone...
It's like a whole menu of options.
When would they opt for one of those other than the laser removal?
That's a great question. Laser has become the go-to because it strikes a good balance between effectiveness and safety, especially when you compare it to the more invasive techniques.
Right.
But laser isn't always the ideal solution.
Okay.
Some ink colors, those vibrant greens and blues,
Oh, really?
can be stubborn, and that's where those other methods might come in.
Okay, so it's kind of like a toolkit.
Yeah, exactly.
Where you pick the right tool for the right tattoo.
Each one has its pros and cons.
Okay, well, tell me a little bit about how this laser removal works.
Oh, it's pretty fascinating.
Yeah.
Think of it this way. Tattoo ink sits in layers beneath your skin, right?
Right.
Laser energy targets those ink particles,
Okay.
breaking them down into tiny fragments
Oh, wow.
that your body can then flush away naturally.
Oh, that's cool.
Each laser session targets a different layer,
Oh, I see.
which is why you need multiple sessions.
Oh, okay. So it's not just it's not a one and done kind of thing.
Zap it and it's gone.
Yeah, it would be nice, but no.
But the body has to your body needs time to process and flesh out those fragmented particles between treatments.
Yeah, that makes sense. But so does that mean complete removal is always possible?
That's a key question for anyone thinking about removal.
Right.
While a lot of tattoos can be significantly faded or even completely removed, it's not always a guarantee.
Okay.
Factors like the ink color,
Oh, right.
how deep the tattoo is, even your skin type,
Oh, wow.
they all play a role.
Okay, well, what about the experience itself? I imagine it's not exactly a walk in the park.
Well, the article describes it as similar to the feeling of a rubber band snapping against your skin repeatedly.
Oh, okay. But they have...
Not exactly a picnic, but hey,
Yeah.
topical numbing creams can definitely help.
Okay, so there's something at least.
Yeah, it's not like you're just left to suffer.
Right. Are there any other risks, though, that people should be aware of?
Well, with any procedure, there are potential risks.
Right.
Scarring, infection, and skin discoloration are all possibilities.
Oh, okay.
Although they're less likely when you're in the hands of a qualified professional.
Right, so it's important to...
Which highlights the importance of doing your research.
Yeah. Finding the right person?
Yeah, and finding someone with experience and expertise.
Absolutely. So if you're thinking about doing this, you really got...
Don't just go to anybody.
No. What's the best way to find someone?
The Cleveland Clinic suggests starting with your primary care provider.
Okay.
They can probably refer you to a dermatologist or a plastic surgeon who specializes in tattoo removal.
Okay.
It's also a good idea to consult with both a dermatologist and a surgeon.
Oh, okay.
Just to get a well-rounded perspective on your specific needs.
Okay, that makes sense.
Because it's your body, right?
Yeah.
And you want someone who understands not just the technical side of removal, but also your individual skin type and the specifics of your tattoo.
Yeah. So before we get into the actual laser removal process, I want to just sort of take a pause here and think about, our listener.
Absolutely.
What are your thoughts so far? What stands out to you?
Right. What questions are popping up in your mind?
Yeah. Anything surprising you or making you kind of rethink your assumptions about tattoo removal?
Yeah, because we're going to delve deeper into the details in just a moment.
But I think it's important to acknowledge that this is a personal decision.
Very much so.
And you're not alone in this journey.
I think that's a great point to transition into the nitty-gritty of the laser removal process.
Okay. Perfect.
There's a lot to unpack.
Yeah, there is.
So let's dive right in.
Let's do it.
Shall we?
Okay. Welcome back, everyone. So before the break, we were just getting into what a laser tattoo removal session actually looks like.
Right, like what you can expect.
Yeah.
It's pretty interesting stuff. So let's dive in.
Okay, cool.
It all starts with a detailed consultation. The article really emphasizes how important this step is.
Yeah.
It's where the practitioner really evaluates your skin, the tattoo itself. How big it is, where it's located, those tricky ink colors that we talked about.
Yeah.
And they'll probably take some photos to track your progress.
Oh, okay. So it's not just...
Yeah, it's not just like show and zap away.
Right.
They really take the time to understand your situation.
Yeah. Okay, so that's where the ink colors and all that stuff comes in.
This is where those variations in ink colors and tattoo depth really come into play. The practitioner will use this information to determine the type of laser and energy level that's going to be most effective for your specific tattoo.
So it's kind of like a personalized...
It's a personalized treatment plan, not a one-size-fits-all approach.
Got it. Okay, so walk me through what an actual laser session, what happens?
Well, first and foremost, safety is paramount.
Okay.
You'll be given protective eye shields to wear during the treatment. And then the practitioner will usually test a small area of your skin just to see how it reacts to the laser.
Okay.
And to fine-tune the settings.
So I imagine it feels pretty high-tech.
Oh, it definitely has a sci-fi feel to it.
Yeah.
Once the settings are dialed in, the practitioner uses this handheld device that emits pulses of laser light onto the tattoo.
Okay.
It's not like a continuous beam, more like a series of targeted zaps.
And those are what break down the ink.
Right, exactly. The laser energy heats up the ink, shattering those large particles into smaller fragments.
Oh, wow.
That your body's lymphatic system can then absorb and eliminate naturally.
So it's your body that's actually...
It's quite remarkable how your body works
in
conjunction with the laser to actually remove the ink.
That's really cool.
Yeah.
So what happens after the session, though?
Oh, that's a great question.
The article mentioned aftercare is really important.
Yeah, aftercare is crucial.
Oh,
you might experience some redness, some swelling, maybe even some blistering.
Oh.
All normal reactions.
Okay.
Your practitioner will give you specific instructions on how to care for the treated area, which might involve applying some antibiotic ointment, keeping it bandaged, and avoiding sun exposure.
So it's not just a zap and go.
Right. It's not just a quick fix.
You have to really...
There's a healing process involved.
Okay. Got it.
And that healing time allows your body to flush away those broken down ink particles and prepare for the next session.
So multiple sessions, healing time, aftercare.
Yeah.
Sounds like we're talking...
It's a process.
Weeks or even months, not like...
Requires patience and commitment.
Yeah, not an instant fix.
Definitely not.
Okay, got it. Okay. So laser is the most common. But we did talk about those other options.
Right.
Can you remind me what those were again?
Yeah, but besides lasers, we talked about dermabrasion, chemical peels, and surgical excision.
Okay, so do those follow a similar,
They all involve removing layers of skin to eliminate the tattoo. But the specifics and pattern lines can vary.
Okay.
Dermabrasion, for example, uses a device to basically sand away the outer layers of skin.
That sounds kind of intense.
It can be pretty intense.
Yeah.
It can be effective, but it's generally considered more aggressive.
Okay.
And carries a higher risk of scarring.
So that's why they don't do that as much.
Right. It's typically reserved for situations where laser removal isn't suitable.
Okay.
Maybe because of the type of ink or the location of the tattoo.
Got it. What about chemical peels? Those are kind of similar.
They both work by removing layers of skin, but with chemical peels, a chemical solution is applied to the skin, causing the top layer to peel away, taking the tattoo with it.
So it's like a super intense...
Yeah, it's like a supercharged exfoliation treatment.
Yeah.
But like dermabrasion, chemical peels are more aggressive than laser removal.
Okay.
And they have their own set of potential risks and side effects.
Right, got it. So laser is definitely the preferred.
Yeah, laser is often the preferred method.
But these other options exist if you...
Exactly. It's about having different tools to address the unique needs of each individual.
Okay, now, the article did have a pretty strong warning about at-home tattoo removal.
Right, the DIY approach.
Yeah.
And for good reason.
They seemed pretty against it.
Those at-home kits or creams, they often contain harsh chemicals or rely on these abrasive techniques that could really cause more harm than good.
Yeah.
They're unlikely to fully remove a tattoo.
Right.
And can actually lead to skin damage, infections.
Oh, wow.
Or even permanent scarring.
That's pretty serious.
Yeah, it's just not worth it. If you're serious about tattoo removal, consulting a qualified healthcare professional is always the safest and most effective route.
Okay, got it.
They have the knowledge, the expertise, and the tools to guide you through the process safely and achieve the best possible outcome.
It seems like the takeaway here is to make sure you make an informed decision.
Informed decision-making, absolutely.
Yeah, and not just about the removal, but also like...
Right, it's not just about knowing the ins and outs of the removal process, but it's about really thinking through the implications of getting a tattoo in the first place.
Right, because like we were saying, tattoos, they're a form of self-expression.
Exactly. Tattoos are often seen as a way to express yourself, and they can be incredibly meaningful.
Right.
But it's important to remember that our tastes change.
Yeah.
Our beliefs change. Our lives change.
Yeah.
What resonates with us at one point in our lives might not hold the same significance later on.
And that's where the whole emotional side of this comes in.
And that's where the emotional aspect of tattoo removal comes in. It's not just about erasing the ink. It's about addressing the why behind that desire.
Yeah, and even that decision can be really tough.
It can be a tough decision.
You might feel guilty about not thinking it through before.
Absolutely. There might be guilt over not thinking it through initially, fear of judgment from others, or even a sense of grief over letting go of something that once held meaning.
So it's important to like...
It's a journey.
Yeah.
Both physically and emotionally.
Yeah.
And it's okay to seek support along the way.
Right, like a therapist.
Yeah, therapy can be helpful.
Talk to your friends and family.
Talking to trusted friends and family is important.
That's great.
And even connecting with online communities where people share their experiences.
That's a good idea.
That sense of community can be so valuable in normalizing the experience and realizing you're not alone in navigating these emotions.
So for a listener, I want to ask you, knowing what you know now about tattoo removal, both the technical and emotional sides, how has this deep dive changed your perspective on tattoos?
Yeah, do you find yourself looking at your own tattoos differently now?
Yeah.
Maybe appreciating the artistry and permanence even more?
Or maybe you're thinking more about the decision-making process.
Right. Or has it prompted you to think more deeply about the decision-making process?
Yeah, like really thinking about
to really weigh the long-term implications before going under the needle.
Yeah.
Ultimately, the choice is yours,